Good afternoon, everybody. We are anticipating a few more people joining us today. I will be admitting people as they come into the meeting, but we're going to go ahead and get started because we have lots to talk about today. My name is Chris Sorchik, and I am the Executive Director of Capital Area Healthy Start Coalition. I want to thank you for joining us for our Lunch and Learn series this afternoon. Today, we will be discussing breastfeeding. We are talking about the benefits of breastfeeding, local breastfeeding initiatives, groups, and support for our families in Leon and Wakulla County. Today's moderator is Ms. Dykebra Gaskin. Ms. Dykebra is the Public Health Nutrition Program Director for the Women, Infants, and Children Program for Leon, Wakulla, Franklin, Jefferson, Madison, and Taylor counties with the Florida Department of Health in Leon County. She is the co-chair of the Breastfeeding Policy Work Group and the current president of the Florida Breastfeeding Coalition. She is one busy lady. She is joined today by guest panelist, Ms. Susan Taylor, co-founder and active member of the Capital Area Breastfeeding Coalition, Ms. Heidi Shavers, lactation nurse with Tallahassee Memorial Healthcare, Sandy Glazer, the administrative director here at Capital Area Healthy Start Coalition, and Carrie Raphael, who is our Sister Friends Tallahassee Birthing Project Manager, which is our newest coalition initiative. And with that, I'm going to turn it over to Ms. Dykebra.
Thank you so much, Chris, for that wonderful introduction. And I'm grateful to the Healthy Start, the Capital Area Healthy Start Coalition for putting this on and for being just such great partners to the Wic Program and everything that you guys do to support families in this area, especially when it comes to infant feeding, child safety, and of course, breastfeeding. I wanted to start because breastfeeding is so, important to me. I'm very passionate about it. And even before I became a mother myself who breastfed 2 children, I learned so much about breastfeeding, and a lot of that had to do with just meeting people in WIC, where I work now, and people in Healthy Start. And breastfeeding is important because we know that it is the optimal food for human babies. It's perfectly designed. Even before a woman can feel her pregnancy progressing, by the time she moves into her second trimester, like her milk is already ready for her, like it's starting to mature, it's starting to come in. I remember having a baby at 23 weeks and I already had milk ready to go. And that's just how early your body is prepared, just in case you have a premature baby, you can start to make milk. And she was born at TMH, and that was one of the first things they asked me for, was to get her some milk. And they wanted her to have the colostrum because it's so rich in antibodies. And she was so tiny, and it began to coat her stomach. It began that first protection for her. And of course, it provided nutrition for her before she could really take, food by mouth. So you have the colostrum, that first food, or we call it the sacred first food, is really rich in antibodies. So it begins to protect babies. And then just other benefits of breastfeeding is just the bond that mom and baby gets with breastfeeding. It also releases something called oxytocin, which is what helps your milk let down. But a lot of people know oxytocin as the love hormone. It gives you feelings of happiness. It relaxes the baby. It relaxes mom. And there's some research that suggests that breastfeeding can help reduce depression. It's actually pain relief for moms and babies sometimes as well. And then we all know that research has, gone above and beyond and shown us that breastfed babies have a reduced risk of, middle ear infections, GI problems. They have a reduced risk of developing food allergies. They have a reduced risk of developing chronic conditions like diabetes, even osteoporosis, high blood pressure as they get older. So there's so many benefits. And then for moms, we learned that by breastfeeding, they actually reduce their risk of certain types of breast cancers, pancreatic cancer, ovarian cancer, I lost my train of thought, but there's so many benefits for women as well. When I learned about the relationship with breastfeeding and the reduction of certain types of breast cancer, I learned that there's a specific one called it's an estrogen related type of breast cancer. And this one specifically affects women of childbearing age. And it's interesting because a lot of times when this cancer is found, it's already well into stage 2 and 3. So just knowing that that type of breast cancer that's specifically for women of childbearing age, and then there's something that can help reduce your risk, that is something that's amazing. And some people say, well, you know, I breastfed my baby, but I had breast cancer anyway. But I said, but you're living to tell the story. So there's new research that shows that a lot of people, their survivability is a lot higher just by having that breastfeeding. So it just shows how breast milk and breastfeeding can have a protective effect. And like I said, you know, breastfeeding is more than just breast milk. It's the bond, it's the action. There's so many things, and I can talk about it for forever because again, I'm so passionate about it. Some of the stats on breastfeeding right now in the United States, about 84% of women are giving it a try. We call that breastfeeding initiation. And that was released by the CDC in 2020, but those were 2017 stats. I'm pretty sure it's a lot higher. Unfortunately, by 6 months, just under 60% of babies are still getting some breast milk, and about 20% of babies are being fed formula for different reasons by the time they're 2 days old. And what's really nice is that there's initiatives in place. For example, our local hospital, Tallahassee Memorial, recently got a designation called Baby Friendly Hospital Initiative. And that initiative means that that hospital or birthing center is dedicated to the 10 steps to breastfeeding. And those 10 steps are things that you have to make sure baby's getting skin to skin. It's promoting that. And no artificial teats, like no pacifiers, and different practices to justify and document why a baby really, really has to have formula. If there's no medical justification, then that mom and that baby's going to get some extra breastfeeding help. And what's really nice is sometimes things aren't going as perfectly, but instead of saying, well, here's some formula, your baby didn't have a wet diaper right away, no, they're giving you more breastfeeding help. And that actually was my experience right when TMH got their designation. So that brings me over to Heidi Shavers, who is a registered nurse, and she's an IVCOC at Tallahassee Memorial. And she's going to talk to you about what's going on with Baby Friendly. And she's also going to talk to you about the mom perspective with breastfeeding. So I am going to shift over to Heidi. Welcome, Heidi.
Thank you so much. It's an honor to be here with these distinctive women of great importance in our community, and sharing the same goals of helping new mothers and babies get the best start possible. So you did a wonderful job of sort of prepping my little segue into my talk. So we are actually ready to, are getting ready for our updates with Baby Friendly. So we do quality projects to make sure that we're all doing what we need to be doing to help get and keep moms up and running with their breastfeeding experiences. And something that's important for moms to expect, we want to make sure that they are aware that we are available. All of the nurses are here to help them with their journey with their babies from the get-go, from the time their babies are born, as you mentioned so perfectly. We're doing skin-to-skin care. When those babies come out, we're trying to delay any kinds of procedures while mom and baby are making this very important transition after the baby's birth. What we want to do is allow that baby to be skin to skin, naked baby against mom's naked skin. So nothing, no barriers in between the two of them, so that the baby can actually get the benefit. The baby's dried immediately after delivery and placed right when the baby's on mom's abdomen. And now if there's a need or any concern that the baby needs or mom has a need, we obviously will attend to any medical concerns or needs first and foremost. But most of the time we can just put that baby right up on mom's chest, dry the baby so that that baby can get the benefit of being with its mom, going from that in utero, very cozy environment where the baby can still experience mom's, the rhythm of her breathing, her heartbeat, and that sense of containment. We'll put a little hat on the baby's noggin and a blankie over the baby to keep the baby warm. But mom's body set skin to skin is actually the perfect environment for the baby, as the baby will receive mom's warmth, baby's calm, they organize, all they know is mom's heartbeat, the rhythm of her breathing and all of those things, and they can still experience that in this very important transition. If babies are less stressed, then they're not burning as many calories, they maintain their temperature, they don't drop their blood sugars, and they will be more likely to be in that perfect environment to experience mom's wonderful colostrum and milk from the get-go. So nurses, nurses are always coming with us, and we're, doing orientations for all of our nurses as they enter the maternal child area to try and help them understand and know and experience how they can help the moms and babies make this really amazing transition. We also will continue to help and support moms for the duration of their stay here. And we continue to offer support with one-on-one outpatient visits. We are doing some telemedicine visits. And in the last few weeks, because of the numbers of our COVID cases that have suddenly spiked, we've had to temporarily hold our support group. But we're really hoping to get back to that very soon. So if anybody has any question about when and what's going on and how soon we can get back to our normal activities, then you give us a call at the hospital, and it's, things kind of happen very quickly. And so sometimes it's very difficult to make sure that our families are aware of the different changes. So I just encourage them to call us and ask us so that we can make sure that we give them the current updates on information. But as I mentioned, we are still doing one-on-one outpatient visits. We are doing a few telemedicine visits if those are appropriate. So we don't want anybody to think that there's no service or assistance available to them. Most of the insurance companies are supporting moms for outpatient visits in both of those venues. So we are making sure that part of our quality experiences, surveys with new mothers, finding out, did they get information during their pregnancy about breastfeeding? And did they have anybody that let them know what to expect after their baby was born? So we try not to separate mothers and babies unless either one have a medical concern or need for additional support or attention medically. But even still, if that should happen, we might, if it's something with mom, we might put dad in the mix to do skin to skin with the baby. For moms that have to have cesarean births, sometimes dad will be the initiator of skin to skin until mom gets into the post anesthesia recovery room. And so we're still trying to make sure we keep everybody in together as much as possible. Then throughout this day, then we are really trying to make sure moms are learning skills to use hand expressions so that they can provide their colostrum for their babies, and to get that baby licking, smelling, and nuzzling at the breast to help them make their new adaptation to the new meal plan. And moms are amazing. They are just so happy to have the skills and information to provide the best care they can for their baby. We are trying to delay as many of the sort of care that we would do, interventions like putting drops in the baby's eyes and all of those things, until moms and babies have the opportunity to bond together and hopefully at least have a good first feeding before we do any of those kinds of things. But making sure that as a part of prenatal education, that moms know that, we may not weigh the baby right away. We may not take the baby from her if at all possible, so that we don't interrupt that continuum of care, warmth. And those first feedings are so important, because that's the jumping off spot where these babies may get a great bolus of that perfect food that you've mentioned, that colostrum, because that will help to stabilize their blood sugar, their temperature. And after that good first feeding right after delivery, then they may shut down for a while and recharge their little baby batteries. So they've been through a lot. So they, after that first good feeding, everybody may chill for a while and rest from all the activity they've had. But we want to continue to help and support moms throughout the continuum of their stay in the hospital. Lactation services are available to them while they're here. They are also available, the nurses are, available to help moms as well. So we want to make sure that we're all here to help and support their activities. One concern that we have is the number of late preterm babies that we do have right now. And I don't know what's going on, but there just seems to be a lot of babies that are a little earlier than we would like them to be, who do need some extra help and support. And sometimes we have to do things a little bit differently. But even still, if a baby is having any issues, we are right on top of helping moms with hand expression and pumping to get their milk supply up and running, so that should the baby require any other nutritional support, that mom is able to, as much as possible, provide that for them, and to keep on her goals for establishing a good milk supply. So one other thing that has currently happened is we have changed over from using the Amida breast pumps and the Amida Elite pumps, and we have all Medela Symphony pumps now. We do have a pump for every room, every postpartum room, and down in the NICU as well. So we encourage those moms who do have that need to, for whatever reason, to augment or support their babies, even if they have to go to the NICU. We are trying to make sure that they are supported by mother's milk. Should the baby require supplementation in the NICU, we are making donor milk available to those babies if, as moms agree to proceed with that as needed. So it's really, we're so lucky that we have that as an option to try and continue our goals for providing exclusive breast milk as much as possible for our newborns. Two other little things I wanted to make sure that I mentioned. Should a parent or mom come in and be positive for COVID, We are still encouraging them to breastfeed if she is stable enough and if her baby is stable enough to be with her. We do ask that moms wear masks sometimes when they're with the baby, and especially in the very, very beginning days, the first days. And should she not have her mask on at periods of time, not only do we want her to use good hand hygiene, but because of the droplets that moms with coughing or sneezing and or breathing can spread to her breast. Um, we would like for her to maybe wash her breast before, which is not something we would ever do otherwise, but only because we're trying to minimize the baby's exposure to droplets. So I just want, and those moms who, if they're not well enough or if, for whatever reason, some babies are required to be born earlier than we would like because moms are ill. So we would, as soon as mom is stable enough, we will do our best to try and help and support her with expressing her milk. Same thing with expressing her milk. She may need to wear a mask while she's actively pumping her breast. And just because we don't want incidental exposures to the babies. But one of the great things is several studies have come out very recently. One that has documented that the one study was very small, but women who were vaccinated, the actual vaccine did not go through breast milk to the baby, but moms who have had COVID or who are providing COVID from their breast milk, those babies are showing positive antibodies. So they are getting the immune response or the immune factors through the antibodies from moms to help begin to protect themselves, the little ones, against COVID. So that's very positive. All of the professional organizations, ACOG, A1, the Society for Maternal Fetal Medicine, all of these organizations are now encouraging vaccinations for mothers. And hopefully we can, whether even if they're pregnant or breastfeeding, because of the concern with mothers' potentially compromised immune system. Just the fact that she's pregnant, she may have a little, less immune response than she might otherwise. But with the vaccine, that could really help to prevent her from getting COVID or as sick as they often will get. So please, let people know that we're not, we're trying to do our best to protect mommies and babies. So I think that's about it, unless anybody has any questions. But we're hanging in there.
Thank you so much. That was really, really good to hear, Heidi. I remember when I had Liana 3 years ago, we were so tired from a long labor, no epidural. And sure enough, she fell asleep and I fell asleep. And Angela comes in to try to help me with breastfeeding, and the poor baby's just dangling off the nursing pillow. But we were so tired. And I remember just having that assistance was really, really helpful. She ate and just passed out. So I definitely remember that. So speaking of which, with breastfeeding resources, there are a lot of resources in the community that are still available. You can always reach back out to the lactation consultant that worked with you at your hospital. And a lot of moms are delivering at home with a midwife, or they will use like a birthing center. And usually the midwife has some, certifications or lactation training that can be of assistance to a mom that they help with birthing. That makes sense. But if you have a problem that kind of goes beyond their scope, you can always look for that, that professional with the IBCLC designation. You can also talk to your OB or your provider about anything with breast health, nipple concerns. Those are things that are part of their wheelhouse, and it makes sense to have that discussion. Even before you decide to have a baby, if you're just thinking about having a baby, maybe there's some family history you want to discuss. If you've had surgeries, you want to talk to previous surgeries, you want to let your lactation professional know, and your provider, especially the one who you intend to do prenatal care with. Community resources would be something like, your local WIC office. There's lactation consultants in the community who have private practice. There's also the Capital Area Breastfeeding Coalition, and Susan Taylor is about to talk about that. And then we also have our local breastfeeding policy group, which is an interesting group. They focus more on policy related issues with breastfeeding. And because some of the statistics show that we have a lot of moms giving breastfeeding a go, and a lot of them will stop breastfeeding or run into a lot of barriers and difficulties when they transition back to work. Remember, in the United States, over 60% of women are back in the workplace within 6 months of, having a baby. Some of them are back to work within 14 days, no matter how they delivered. So about, it's going on 6 years now. It's about 6 years now, in 2015. Some of us in the community got together because we were kind of worried about the fact that people were having workplace issues. And when the Affordable Care Act came out, there was some language in the labor laws that said, women should be able to breastfeed their baby on the job or pump milk when they come back to work. And so some language was put in, but unfortunately, as late as 2015, even though this law passed, I want to say 2011 or 12, a lot of that was not being executed at everyone's job. So this group got together, myself, some people from Whole Child, which the breastfeeding policy group is housed under, Susan Taylor herself, Heidi, Angela, lactation consultants from TMH, and other stakeholders again. Doctors, pediatricians came and worked with us, and we kind of formed this kind of consortium. We call ourselves a work group to address it. And it's really nice. A lot of the things that we've been able to do is, we help lead the charge to get what's called a Mama Va pod into the airport and the Civic Center. And if you have a chance to Google Mama Va, you can see it's a cute little pod, and it gives you just a private place to be able to pump milk or breastfeed your baby when you're in a very, very public place like an airport or the Civic Center when they're having events. So that's some of the things we've done. You might have seen some articles we put out in the newspaper where we're just advocating breastfeeding, talking about the importance of breastfeeding. But the really important thing about this law is just a lot of employers didn't know about the law, or they didn't even know that someone needed to breastfeed. So we try to empower people who reach out to us in the community to definitely speak up. If you intend to breastfeed your baby and you intend to go back to work, it should be a discussion. The policy group is actually available to help any business owner or employer develop their own breastfeeding policy or, a plan to support their workers. So it's a really, really, really nice group, and I'm proud to be a part of it. Again, it's housed under Whole Child Leon because of the pandemic. We haven't been meeting there. We've been doing our meetings virtually, and we've kind of slowed that down to meeting quarterly. And it's just because almost everyone in that group is doing something with COVID where it's just really, really hard to get together. So it's really just become necessary for so many of us to kind of pull back. But if it's something you're interested in, I'll make sure I put my email in the chat. You can reach out to me and we'll put you on the mailing list so that you can be updated about our next virtual meetings. We've had other people participate in that group. We've had Susan Taylor, who's really just really big in the community as far as breastfeeding. She was a breastfeeding coordinator in Gadsden County for Wic in the past, and I'm going to talk about Wic a little bit later. But again, she's part of the founding persons of the Capital Area Breastfeeding Coalition, which really works closely with Capital Area Healthy Start. And we've had other people like Dr. Joan Meek, who is a medical doctor. I think she has a family practice background. And then she's also a lactation consultant and a registered dietitian. So she's really interesting. And she's on faculty at the College of Medicine. So she's come in and worked with us. We've had other pediatricians work with us, and other people of Healthy Start, public health background, community workers. So it's just a really great group of community members, and we just really care about breastfeeding. We want to see more people breastfeeding, and what we don't want people to stop breastfeeding because they had some unclear understanding about what happens in the workplace and what they're allowed to do. And we've written letters, the local coalition has written letters before to businesses saying, hey, people need to be able to breastfeed, at their job and things like that, or in public places. We just kind of really focus on advocating for what's going on a day-to-day basis. And again, we don't want something like work to prevent people from being able to continue to breastfeed their baby. So it's a lot of advocacy going on the community level, but again, focusing more on workplace issues. So I'm going to switch over to Susan Taylor, and she's going to be the next voice you hear. And again, she's just been a giant in this area as far as breastfeeding. She was the first person to bring me in and teach me about breastfeeding when I was on my internship. And I just learned so much. So I'm so grateful to Susan, and I'm going to give her the floor. Thank you, Susan, for everything you do for this community for breastfeeding.
Thank you, Daikebra. Thank you for such a kind introduction. I feel like we're such a team. I'm constantly learning from everyone that's on this call and others who aren't able to make it. I'm so impressed with all of you and so grateful, Capital Area Healthy Start Coalition, Chris, because without you, the Capital Area Breastfeeding Coalition would not be what it was, because what it is, pardon me. And also what you see here is that everybody that's on this panel is involved with the Capital Area Breastfeeding Coalition in some way, and actively so. But 28 years ago, we, the Capital Area Breastfeeding Coalition, signed a memorandum of agreement with the Capital Area Healthy Start Coalition to become an affiliate, so that we have a really close working relationship. And one of the first things that was a part of that was actually the executive director of the Capital Area Healthy Start Coalition at the time talked to people at the state about the importance of breastfeeding and infant mortality, because breastfeeding has a significant effect on reducing infant mortality. And especially it makes a difference with all babies, and it really sort of levels the playing field with Black babies and other babies of color when they're breastfed, as far as infant mortality goes. So that was a huge thing that still is something that's super important. But so grateful for that beginning. So, and our mission is to promote, support, and protect breastfeeding as the standard for the physical and emotional nourishment of babies and young children, and for the well-being of families. So you can hear today how that's being lived, with the people who've already presented, with Heidi and Daikebra, and there'll be more coming with with those who are yet to speak with us, Carrie Ann and Sandy. So I was asked to do this because I was one of the co-founders, and so I know some of the history, and people wanted to hear some of the history of this. I do want to give a shout out to the current chair of the Capital Area Breastfeeding Coalition, Hannah Barnes, who's a senior public health nutritionist supervisor at Gadsden County Wic. And she's been a dynamite person on our coalition, as well as all the people here on this panel, but I did want to lift her up for all that she's done. So let's just go back to our founding goals. And basically those of us who got together for the coalition were lactation specialists in the community. There were no certified lactation consultants at the time. There were about 2 international board certified lactation consultants at that time, 28 years ago. There was not baby friendly 28 years ago. So we can see how the community has really grown into these founding goals. And so I just want to read about the founding and the goals with the founding. So the founding goal was to facilitate the development of the Leon-Gadsden County area into a model breastfeeding community, as described by Florida Healthy Mothers, Healthy Babies, with Carol Brady as executive director. That organization does not exist now. It's morphed into other things. So a model breastfeeding community is a community that provides a continuum of services which promotes and supports breastfeeding as the optimum method of infant feeding. This continuum encompasses the community, preconceptual care, prenatal care, intrapartum care, postpartum support, and follow-up, and also the work site and other places. The goal is to have this continuum available and to ensure that breastfeeding mothers move with ease within the different components of care. And so the theme of National Breastfeeding Month, which this is the last day of, is every step of the way. And so it's incorporating breastfeeding into every bit of the community. And as we've already heard, how it is what babies expect to do. It's biologically the ground of babies' health and moms as well. And we know that there are some rare exceptions where that can't happen. And we support all moms, and babies and families. I just want to make that really clear. So this theme of World Breastfeeding Week, or month, 2021, we continue to expand on the original goal by encouraging a more equitable, seamless access to lactation care and addressing lactation promotion, protection, and support. And we see it as a public health issue, not just a lifestyle issue, so that it's a really fundamental priority in public health. And I think one of the main things that the Capital Area Breastfeeding Coalition has done with the people who are part of it is to help get that message across, that it's a public health priority. It's not a lifestyle, just a lifestyle choice, but it is a public health priority. So it's really exciting to experience here today the progress that has been made. And as far as equity goes too, it's like equity and reaching out to all racial groups, more of that happening. And also equity and with people of various gender identities, incorporating that. These are areas of inclusion that are so important and what we need to keep working on. So we're all going to be collaborating more and more with a wider variety of community members to achieve our goals. And as far as joining our coalition, I just want to say it's super easy. Just send me an email. Anybody that's interested, we really want to have you on board because it is a community process. And I'll say a little bit more about that later. So I just want to quickly go through, like within the founding goals, there are some clarifying goals that we recognize in community-wide lactation protection, promotion, and support. And so some of those goals are, first of all, we are a coalition that supports the people who are out there giving support to families with breastfeeding. And we help to give evidence-based support that you can count on, so that the coalition itself is supporting those who are giving the support. We do have, before COVID, we went to a lot of health fairs, baby showers, and that's where we had one-on-one connection with the community. And that was powerful, that was huge. So of course, we're not doing that right now, but we really want to support all of you, all of us who are out there giving the one-on-one support to families. We want to increase the breastfeeding initiation and duration rates to those recommended by the American Academy of Pediatrics and other health organizations, including the World Health Organization. And we're informed by the recommendations of the Lege League International, the United States Breastfeeding Committee, Florida Breastfeeding Coalition, which Heidi Shavers the president of right now, yay. And the United States Lactation Consultant Association, the Florida Lactation Consultant Association, the Center for Breastfeeding, and so many more recommendations of the Academy of Breastfeeding Medicine. And also we abide by, as far as the World Health Organization goes, the World Health Organization UNICEF International Code of Marketing of Breast Milk Substitutes. And so that we go by that when we have booths at health fairs, that we want to make sure that we are giving evidence-based support for breastfeeding. And it's important, as we've said before, to have formula at some times, but sometimes the way in which it's marketed, it can interfere with breastfeeding. So we want to make sure that we're following the guidelines of the International Code of Marketing of Breast Milk Substitutes, so that formula does not interfere in the cases where babies can exclusively breastfeeding, which is most of the time, so it doesn't interfere with that. And we want to provide evidence-based information to physicians, nurses, nurse practitioners, midwives, all healthcare professionals and paraprofessionals, so that is evidence-based, as I had mentioned earlier, but just want to emphasize that. We want to equitably increase the number of international board certified lactation consultants and certified lactation consultants, the IBCLCs and the CLCs, not lactation consultants, certified lactation counselors, pardon me, whose education is based on accurate information and practices shown to be effective. There is a need for more Black and other people of color lactation counselors, lactation consultants, to come into the field. And we want to support that, and we have as a coalition. We want to have a current social media presence, and we're learning more about that, how to do that, because that's where moms and families go for lactation help now. A lot of the time, in-person help is so very, very valuable, but not everyone is in a position to take advantage of that or wants to. And so the social media presence is really important. And we want to increase our membership, so please join us, email, and we meet once a month virtually. We're experimenting with 3 o'clock in the afternoon to see if we can reach more people. And we'd love your ideas and really want to include as many people as possible. I would like to just go over just a few of our accomplishments. That first of all, our first thing was that we obtained funding from the Florida Healthy Mothers, Healthy Babies to work toward the Tallahassee, Gaston County area becoming a breastfeeding community. And that's where we were able to purchase our tabletop display and our banner. And we purchased 2 reconditioned hospital grade breast pumps, 1 each for Leon County and Gadsden County Wic programs to lend to moms who needed them. And we completed a needs assessment for breastfeeding support among physicians and acted to address those needs. And not long before we were officially a task force, we supported the Florida law, giving mothers the right to breastfeed their babies wherever they are with their babies, even if their nipples show. That was a huge thing. So that was in 1993. We gave mothers business cards with the law written on it so that they would know that they could breastfeed wherever they were with their babies in public. So though someone might want to breastfeed privately, that's their choice, and it's good to have a place for them to breastfeed privately. The law protects them to breastfeed wherever they are. They do not have to go into a private place. It's the normal thing for moms and babies, and we want to support that. And we publicized the federal law, break time for working moms, for nursing moms, break time for nursing moms, which gave women the right to express or pump their milk at their place of employment with certain exceptions. And there is now a new law, a bill that's coming forward that we're asked to help support, which is called Providing Urgent Maternal Protections for Nursing Mothers. And can you all still hear me? Something broke in here. So that is a bill that we're going to be supporting because that fills in some of the gaps in the 2010 law that will actually reach salaried employees and not just hourly employees. And will explain to businesses more clearly what it is they need to do as far as what reasonable pumping times are and what they can do. So it's more helpful to everybody. We created our Feel the Love Breastfeed logo, and that logo was done by a local graphic designer, and the slogan was actually offered by a Gadsden County Wic health tech, Debbie Sines. So that was a special thing. We provided breastfeeding education to Healthy Start programs to help them meet their breastfeeding requirements. We have sponsored many World Breastfeeding Walks, and we gave breastfeeding books to doctors' offices, triage tools to physicians' offices, provided them with evidence-based information for themselves and for their moms and families. So I won't go into all of this, but because there is so much. One of the things that recently we've really loved doing is working with the Tallahassee breastfeeding policy work group. We have a liaison there. It's a very important group because policies are really the bottom line, because when you have a policy and you follow it through and you see that it happens, that's when change happens. And the fact that Tallahassee Memorial achieved the baby-friendly certification was a stunning event, stunning. And it's made a huge difference. And our coalition was active since 1995 in supporting that happening. And for that to happen, they needed a local breastfeeding coalition to be supportive of it. And so the Capital Area Breastfeeding Coalition was supportive of that, along with so many other people. But it's that sort of thing that we've been, and we want to help them keep that designation. So we'll be here to help with that. We also provide a local breastfeeding resource guide for the community, and we keep it updated. We've just recently sent one of those out by social media. And if anybody needs that, please, contact, I guess Chris probably has that too, or you can contact me. I can get it to you with my email, susantaylor410@gmail.com. I think that's probably enough, you know. And we really, really are so glad to be here today and are open to the questions that you might have. We encourage, as I said, everyone to join us. And we're so fortunate now to have many, many certified lactation counselors in our area, many international board certified lactation consultants compared to when we started. So our community has done a really wonderful job, and the Capital Area Breastfeeding Coalition applauds everyone. And thank you for working with us on this.
Thank you so much, Susan. Yeah, I agree. The Capital Area Breastfeeding Coalition has really, for a long time, led the charge and definitely has made Tallahassee and Leon and Gadsden definitely more of a breastfeeding friendly community that supports breastfeeding families. And I would be remiss, you know, because I forgot to mention the Lege League as another breastfeeding resource. And we have actually a member of the Lege League who is part of the Capital Area Breastfeeding Coalition. And what's nice about them is besides breastfeeding, they actually do regular meetings that even include weaning and introducing solids, which is related to nutrition. And that brings me to the Wic program, which is what I'm part of. And my background is as a nutritionist. So I do nutrition counseling, and Wic is good because we serve pregnant women in low income area. We serve children, well, babies from 0 to age 5. And basically, you know, you come in and we do the food benefits for those families, for families that need infant formula, we do that. But what's near and dear to my heart, besides the prenatal nutrition and counseling about breastfeeding, is the counseling about breastfeeding, I should say. And another benefit with WIC participants is we have our breast pump program and we have our breastfeeding peer counselor program. And I really love the peer counselor part because we're able to pair someone who's trying to breastfeed who with a peer counselor, and that's someone who most likely participated in WIC and has a little bit of breastfeeding education training. And then they can refer them to someone with a little bit more experience or a credentialed person if they need more breastfeeding support. But it's just really nice to know that there's other people within your peer group that's experienced what you have. So that's really what WIC has been doing to support breastfeeding. If you don't know much about WIC, we are a nutrition program again. It is income-based. We take a lot of referrals from Healthy Start. I get people from the coalition reaching out to me saying, hey, you know, this mom may be interested in breastfeeding. And again, with the breastfeeding peer counselor program, we pair them up with someone. With our pump program, right now we have a limited amount of pumps, but we do hospital grade pumps. And we kind of limit that to moms who are exclusively breastfeeding and are needing to go back to work. We get a lot of referrals from the hospitals, especially our preemie babies. Like Heidi said, we're getting a lot of these late term preemies, but ever so often we get these 1 and 2 pound little ones. And when mom is discharged from the hospital, she needs to be able to express her milk. So if she's participating in WIC, that's something that she will have access to so that she can seamlessly continue to pump her milk. And a lot of our participants are also participating in other programs in addition to WIC. One of the biggest programs that they're participating in is the Healthy Start program. And the next voice you're going to hear is Miss Sandy Glazer, who's also a certified lactation counselor, but she works for the Healthy Start program here in Leon County. And Sandy has been a huge breastfeeding advocate. She took it upon herself to just learn about breastfeeding because she wanted to be able to support the families that she serves. And Healthy Start is such a really cool and unique program. They really look to help reduce barriers to care that families need. And sometimes there's things that a Healthy Start worker can find that, you know, the doctor may not hear about, or the WIC nutritionist may not hear about. So I'm really excited about what Sandy has to say. So Sandy, you have the floor.
Well, thank you so much. I have been working with moms and babies locally for nearly 20 years. So I've had the honor of working with some of you ladies as well. And one of the things that I do, as Dakiba mentioned, I'm also a CLC. I have worked directly with providing breastfeeding education and support to pregnant women and babies in our community. And I have had the pleasure of training many dozens and dozens of our Healthy Start care coordinators so that they can provide the services directly to the women and babies they work with. The next slide is just going to give a little blurb about the Healthy Start Coalition and how it fits into breastfeeding. We are a community coalition dedicated to improving the health of infants and their families by working with pregnant women, moms after they deliver, and babies. Some of the things we do is work with the community. We participate in the breastfeeding policy group. We participate in, of course, the Breastfeeding Coalition, and we participate in community events as well as providing direct services to clients. The next slide is going to show a huge list of just some of the services that Healthy Start provides to our clients. When I say to our clients, we have a Healthy Start service that's open to all pregnant women in Leon and Wakulla County, because that's who's under our coalition. It's open to moms after they deliver. It's open to infants up until the age of 3. So if you look at this list, rather than go through this whole list, I just want to share a little bit about what we do working with breastfeeding education in the community. I also want to let you know the programs are voluntary and they're free. So the next slide is going to tell you, I'd love to tell you what we do prenatally with our pregnant women. Heidi was talking about how she asked moms after they deliver if they had any education or what do they know about breastfeeding before they have their baby. Well, through anybody that's been in Healthy Start will have, if they're interested, received information on how to prepare for breastfeeding. What does that look like? Some of the things that they go over that our wonderful Healthy Start care coordinators go over with these moms are some of the benefits of breastfeeding. There's a lot of myths out there. They hear all kinds of things. Oh, it's gonna hurt. If I breastfeed, my breasts are going to fall down to the ground. I don't want that to happen. And there's lots and lots of myths. So they help dispel the myths. They also help these moms work through barriers like, ooh, I don't want to breastfeed. Not only have I heard it hurts, but you know, my family just says I shouldn't. They say formula is better. So our Healthy Start care coordinators help them work through the barriers so that to get them excited about breastfeeding, show them how it helps them and their babies. Of course, then once the moms say they would like to breastfeed, we provide intensive education on what we call the how-tos breastfeeding. How to get a latch, how to know if your baby's getting enough to eat, how to maybe think about some things that may be happening after you start to breastfeed. How to work with engorgement should that happen, how to work with your family when you're trying to breastfeed and they're saying, oh, let's just give baby a formula in a bottle so you can get some rest. They also coach the moms on how to talk to the families so that should that happen after they start breastfeeding, the moms can give their family members who care and they want to help some other duties and jobs to do so they can bond with the baby while the mom still continues to breastfeed. They talk about what mom may need before she breastfeeds as far as breast pads. If she's thinking about pumping, talking about what kind of pumps to get, how to work with her health insurance companies to see how the health insurance companies can help pay for the breast pump should that be needed. supportive bras, and talking about how moms can maintain their health while they're breastfeeding and while they're getting ready to deliver the baby and prepare for breastfeeding. And the methods they use, they try to make the methods interesting for the moms. They have videos they show. They have, we have some visual guides, things like different color, they almost look like candles, but different color demonstrations of what colostrum looks like, the color of first breast milk, the color of breast milk when it starts coming in, it turns from that kind of yellowish to the blue color. They even have diapers that show what a breastfeeding baby's poop will look like, so the moms won't be a little freaked out when after they have their babies, and they'll know that the poop should look like for a breastfeeding babies. The next thing, I'm trying to talk a little fast because we want to make sure we have time for our last speaker as well, but the next slide shows what happens after baby's born. So we've provided all this education through Healthy Start prenatally. Moms go to our wonderful, wonderful hospitals or their midwives and deliver. We know that Heidi over at TMH and our local midwives and at Capital Regional, they do a wonderful job getting moms breastfeeding from the start, give them their support, show them the how-tos. At that time, your colostrum is coming in. Usually when moms leave the hospital, some of the moms, their breast milk has not fully come in. Well, they're doing a wonderful job with these moms, and then the moms go home. They're exhausted. They're having a change in their hormones. They're feeling a little overwhelmed. They're not lying in the hospital with somebody bringing them meals. And the very first thing some of these moms say is, I don't know how I can keep on breastfeeding. I'm just feeling overwhelmed. What if my baby's not getting enough to eat? What do I do? And that's where Healthy Start again comes in. Whether the moms are in the programs prenatally doesn't matter. Healthy Start can connect with new moms who are referred to our program when their babies are born. Healthy Start is a home visiting program. So before the pandemic, we were literally in homes helping women literally face-to-face breastfeed. Watch how, with their permission, watching the latch, making sure they were doing it correctly, giving them encouragement. What we did find in going in the houses is almost all moms are breastfeeding wonderfully. They're doing a great job. What they really just need is that little bit of hand-holding and the encouragement. So we're also, now with the pandemic, we do provide telemedicine, which is, we do virtual visits. So if the Healthy Start Care Coordinator and the mom are, Healthy Start Care Coordinator can give some instructions virtually on breastfeeding while the mom is breastfeeding, or if the mom is not breastfeeding at that time, we'll answer questions, show videos, provide handouts by mailing them electronically and delivering them to the homes. They help the moms troubleshoot problems. Of course, if something sounds like it is something more urgent, the mom has more than engorgement, maybe she has an infection, the moms are referred to their medical providers or to pediatricians if they have questions about the development of their babies or are really concerned the babies are not getting enough, or if there's jaundice involved. So our Healthy Start Care Coordinators not only provide guidance in breastfeeding, they also help moms breastfeed past, hopefully so they can get to their at least 6 months, if not a year of breastfeeding. They talk about how to pump, what will happen when you go back to work, how to store breast milk, should moms return to work, and should mom, or to school, or just mom sometimes need a break. You need to get out, take care of yourself. So they talk about how to pump the milk as well. So last thing I want to talk about is how to sign up for Healthy Start. Each 67 counties in Florida have their own Healthy Start program. Our coalition, we have 2 programs under our umbrella, the Leon County and the Wakulla County programs. Our Leon County Healthy Start program is through Children's Home Society, and that number listed there is how to enroll. Our Wakulla County Healthy Start program is through the Wakulla County Health Department. And of course, our coalition can answer questions and connect the moms to programs as well. And that's the last number listed on the slide. And I thank you so much for your time. And if you have any questions at the end, please let me know.
Thank you so much, Sandy. You know, I'm just going to keep it real. I really think, I wish Healthy Start was just something that every single new parent had access to. What you guys do is so important for community members, and it really doesn't matter what your income is, what your background is. Everyone can use just like that information. Even something that seems as frivolous and not important as like the color of the baby's stool in the diapers, which is something we ask about a lot in WIC. That's important to know because a lot of people don't know, like, why is my baby's, you know, stool this color or that color? So what you guys do is important. The next voice you're going to hear is one of Healthy Start's newest team members. And her name is Carrie Raphael. And Carrie, she has a bit of a corporate background, but she's been doing things with childbearing education, breastfeeding education, care management for over 10 years. And she's gonna introduce you to a really awesome program. I talked about how peer support is really important, and that's part of what she's going to talk about on the front end prenatally. I also want to share that Carrie recently became a board of director for the Florida Breastfeeding Coalition as well. And she used to be a co-chair of the Capital Area Breastfeeding Coalition. So as you can see, based on what she does every day, based on what she does on the side, because she does, you know, childbirth class and education, she's very passionate about what she does. And so this is something she's serious about. Just personally, she's just an awesome human being. But she's going to tell you about this awesome and very important program. So I'm going to turn it over to Carrie. So good to see you.
It is wonderful to see you. It's wonderful to see all of the ladies that are on the screen. I will not be before you long. I'm excited to announce the Sister Friend Tallahassee Birthing Project. It has been added to the Capital Area Healthy Start Coalition. And this volunteer program partners sister friends, which are kind of like big sisters, with little sisters, our African-American Tallahassee residents, for the purposes of improving birth outcomes. We're going to put those two together in order to encourage, in order to empower, and to support. And we continue to do this until mommy's graduation when baby turns 1 year old. The Tallahassee Birthing Project started in July, and we're excited to announce tremendous growth. But with growth comes opportunity, which is part of the things that I would like to share with you today. With the community partnerships, we have an opportunity of bringing on more sister friends. What we hope to see is a team of sister friends who partner with the little sisters to encourage and to teach about breastfeeding and to teach about childbirth education and to continue to be that support a full year after baby's here. We also need the community partners in order to refer little sisters to us. Perhaps in the different capacities of individuals who are listening to the call today, you are aware of a little sister who could use a little extra help. We hear with the Wic Program how you could have a peer counselor. You could hear with the Breastfeeding Coalition how they can volunteer and support our community. And with the Sister Friend Tallahassee Birthing Project, you have that peer support. So perhaps you know someone who stands in need. We also need the community to be aware that the program works on a volunteer basis. And this volunteer basis allows you to give, the opportunity to give new and gently used items such as maternity items and baby items is incredibly important to the program. We have little sisters who stand in need and those who have the ability to give. We have an Amazon wish list because coming up is our very first Sister Friend Tallahassee Birthing Project baby shower. We want to shower these little sisters and let them know their community stands in order to support them, in order to help them. You know, the last thing I want to make mention to is that, as Susan Taylor rightly mentioned, this month is Breastfeeding Month, and the last week is also recognized as Black Breastfeeding Week. This year's theme is the Big Pause, And the big pause is a collective rest for collective power. As we consider that theme, we consider us an opportunity to rest and quietly reflect on how to reevaluate our community needs, how to realign what each and every one of us do on a daily basis to our community goals, and to reallocate resources for the needs of our sisters and for our babies. I want to thank you so much for your time. In the chat area, I'm going to share my contact information. If you have any questions, please don't hesitate to reach out. Thank you to everyone who's on the panel today as well.
Thank you so much for that. I think what you're doing is important, and I'm really glad to know that you guys are taking some donations too. I'll make sure I get the word out as well about those donations. So that rounds up all of our speakers. So I'm gonna ask Chris, oh, thank you for putting that in there. And for all of the speakers, if you could put any contact information in the chat so people can see. Chris, how many minutes do we have for Q&A? How are we doing? I know we're a little bit over.
We are a little bit over time, but why don't we go ahead and take about 5 minutes to see if anybody has any questions, and we can extend that if need be.
Okay, does anyone have any questions? If you could like raise your hand or put a question in the chat. Does anyone have any questions? It's good to see so many people participating to join us today.
Kibra, there is a question in the chat. Are the Amida pumps still a good option for home use?
As far as the retail pumps, as far as I know, they're good pumps. I've had a great experience with the pumps. I don't know if any, like Heidi, if you guys can speak on that, but I've had a good experience with the Amida myself.
Yeah, the Amida pumps are fine. You know, we just wanted, especially for our preemie babies, there's some features on the with the Symphony pump that can be a great benefit for moms starting out, especially with a special pattern that mimics the way when a mom is first starting to express her milk using a breast pump, that it keeps it at a faster speed and lower suction while they have that colostrum that's, you know, you don't want it pulling so hard and slow that it's creating so much negative pressure within the ducts that the milk doesn't come out or it's uncomfortable to mom. So it keeps it that's a way to keep it at a pattern that's more user-friendly and appropriate for initiation of breastfeeding or breast milk making. So as needed. But that's a good pump. It's still a very good pump. But we were at a point where we were having to replace them or decide what we were going to do, and we took the big leap. So, you know, we're all good. But I would love to say, just on top of everything else, that, you know, knowing that when a mom leaves this place, she has such wonderful opportunities for help, information, guidance, and support with all of you in the community. I mean, Susan and I go back a very long way. So we've seen the community grow in so many different directions, and meeting a lot of wishes that have been a long time coming, but knowing that we have such a fabulous group of wonderfully supportive and nurturing folks out in the community that are here to keep us going, keep all those moms and babies up and running and breastfeeding.
Awesome. Thank you for that. So Chris, did you see any other questions in the chat? Did anyone? Oh, here's a good one.
Oh, did something come in? Go ahead.
Do you all have a recommendation for a book or guidance for continuing to breastfeed after 6 months and into toddlerhood? I'll speak on that. So the American Academy of Pediatrics, CDC recommends breastfeeding for 6 months exclusively, 12 months, and then the World Health Organization takes it a step further and they say, you know, go 2 years and beyond, as long as it's mutually exclusive. And I'm not aware of any books, but someone else on the panel may recommend a book about what we call extended nursing. I definitely extend nurse my daughters. My oldest was breastfed until she was 3.5. That was my 23-weeker preemie. And then I'm actually nursing a three-year-old. She's in school right now, preschool right now, but she still nurses occasionally. And it's definitely something we at Wic encourage you to do. There's some social media support groups for, families who choose to do extended nursing. But I don't know if there's anyone else. Susan, you have a recommendation about extended nursing, like a book?
Well,
Susan,
I think
your hands up.
the Lege League's book. Oh yeah, am I? Yeah, can you hear me? Can you hear me? Okay.
Yeah.
Okay. The Womanly Art of Breastfeeding by the Lege League. Their most recent book is a wonderful go-to manual for just about any aspect of breastfeeding. And their most recent one is especially good, I think. Very inclusive and talks about, and it's so interesting because really it's the normal nursing, really. We talk about extended, but really that's the norm for human babies. If it weren't for our cultural barriers that we put in place, babies would keep nursing at least for 2 years in most cases, and often longer. And it's okay. There's not one length of time that's given for when you have to stop. So it's up to mom and baby.
Yeah, I agree with you, Carrie Ann. Dr. Jack Newman's Guide to Breastfeeding, he's definitely a proponent of extended, there you go, with extended breastfeeding. So many cultures, like Susan said, it's just part of their culture, where, children are just still taking nutrition and comfort, because again, breastfeeding is not just about breast milk, it's the feeding, it's the protection. I kind of look at breastfeeding as that 4th trimester, because you're still using your body to support the health. And we know now that with toddlers and preschoolers are walking and talking nurslings, they're still getting a good bit of nutrition and calories and protein, vitamins and minerals. And then of course, all those powerful antibodies and human milk oligosaccharides, with prebiotics, probiotics from human milk. I mean, it doesn't turn into white water after they turn a year. So we definitely, as you can see here in Tallahassee, keep on going as long as you like. It's a great question.
And I'd also like to add to that individual who asked that question, there are so many free resources of individuals, the ones on this call and the ones that we work with, that would love to continue to support you. We can do that virtually, as well as in person. There are still a number of us which are getting out into the community and seeing mommies in person. So please don't hesitate to reach out to each one of us individually should you continue to need support.
Awesome. And then Rocio, who's the Lege League. She is a Florida Breastfeeding Coalition board member as well. And she is all the way from down in Miami. And she shared a really good link. Good to see you, Rocio, but she shared a really good link about extended nursing. So I love all the sharing. All right. How are we doing, Chris, on time?
We probably should be at time.
Okay.
So I don't see any other questions in the chat, but if anybody does have any questions, please contact us at the coalition and we will make sure that we send those questions out to the panel and follow up with the participants. The recording from today's session will be available and we will make sure to get that out via email as well.
Thank you so very much. I just want to
thank you, everyone.
Thank you for participating. That wraps up today's events. Thank you for supporting breastfeeding. This was just a wonderful, way to end the National Breastfeeding Month, World Breastfeeding Week. Today is the last day of Black Breastfeeding Week. We just celebrated, breastfeeding so much this month, and it's been amazing. What an amazing year. And if, we'll see you next year. Okay. I hope everyone stays safe. We got some weather here, and please take care of yourself and your families. Thank you. Thanks again, Chris.
Bye.
Thank you.
Thanks so much.
Thank you.
Thank you, Chris. Thank you,
Bye.
everybody.
Bye-bye.
Take care. Bye.
Bye, everyone.